In September of this year, there was an express entry drawn for the health occupation in Ontario, in Canada. And this is something that I feel that you should know if you are planning on coming to study as an international student. This is very vital information for anyone who is still struggling to pick the kind of course they would like to pick. It is important to know the courses that will make you eligible to apply for PR, because as we can see, Canada is going towards this new stage, new phase where they're focusing on some they're focusing on some careers, focusing on some jobs to prioritize when it comes to giving people work permits. So you have to be proactive to know this, to know the jobs on this list, so that you wouldn't make the mistake of wasting money, wasting your time doing a course that wouldn't make you eligible to apply for a postgraduate work permit. So for Ontario, for example, September of this year, they add an express entry draw in the health occupation, and I would like to show you or let you know about those ones on the list and what the CRS score was. So the CRS score was from 414 to 444, which is really not bad at all. While you need to go into the detail about that, you can check IRCC to know how to get the scores, how to get more scores, how to get more points. But things like, those, if you studied here, your work experience, other things to add to make your scores get there. But if you're already working under this list of careers, of these job categories, it's going to help you make that score on time, because this express entry draw is specifically for people working in healthcare in Ontario. So eligible NOC codes include the ones in healthcare managers, physicians, nurses, pharmacists, physiotherapists, psychologists, and specialists in surgery, specialists in clinic and laboratory medicine, managers in healthcare. So if you're a manager in an healthcare facility, your NOC number is 30010, this is really fantastic. And other ones are also veterinarians, dentists, optometrists, audiologists, speech language pathologists, pharmacists, like I said earlier, dietitians, psychologists, chiropractors, physiotherapists, occupational therapists, kinesiologists, and other occupations relating to therapy and assessments, other professional occupations in health, diagnosing and treating, nursing coordinators and supervisors, registered nurses and registered psychiatric nurses, nurse practitioners, physician assistants, midwives and allied health professionals, opticians, licensed practical nurses, this is LPN, paramedical occupation, respiratory therapists, clinical professionals, cardiopulmonary technologists, animal health technologists, veterinary technicians, other technical occupations in therapy and assessments, denturists, dental hygienists and therapists, medical laboratory technologists, medical radiation technologists, medical sonographers, cardiology technologists, and electrophysiological diagnostic technologists, pharmacy technician, traditional Chinese medicine practitioners and acupuncturists, massage therapists, imagine, massage therapists, practitioners of natural healing, dental assistants and dental laboratory assistants, medical laboratory assistants, nurse aid, orderlies and patient service associates, primary technical assistants and pharmacy assistants, and other assisting occupation in support of health services. And for people who are already here, so the idea is that well, if you're already doing anything, if you're already working in any of those lists already, you can start to create your express entry profile. Make sure that you have it up to date so that when they make the next draw, you are already in the stream, or you're already in there. And if you meet the cutoff mark, you can just apply and then you get an invitation to apply. Questions I get sometimes in the comment section is, where does care aids, where does CCAs, PSW, where do they fall in this category? Now they're not straightforward, right? There are some that are just like they said in the last one, is other assisting occupations in support of health services. As a care aid, as a CCA, an assistant, you're an assistant, you are helping other people like the nurses really majorly, to care for patients, to care for residents. So what you're going to check is assistants. And right now the ones here is nurse aides, orderlies, and patient service associates. When you check the job description, it is similar to what we do as CCAs. What I cannot say for personal support worker, but I know it's personal support workers that are called in Ontario. So NOC 33102 fits directly under that. And for other people who are wondering, they don't want to do PSW, they want to do other things, you can find this list on IRCC website. I'm going to put a link in the description box. There are so many things you can do. Pharmacy technician is there, like medical laboratory technologies. Just find the courses as an international student, because I'm sure there are some that wouldn't offer to international students like LPN or whatever, but check to see these things. So use this as guidelines when you are picking the courses you want to do. Your goal is to be a permanent resident, right? Pick courses that will give you higher chances of getting a job after school. You don't want to finish spending thousands of dollars here and not getting a job. So please be careful before you choose a course or a program in Canada. So that is going to be the end of this. I don't want to make this too long. This is just an update video. Thank you so much for watching. I'll see you in my next video. Bye. Please subscribe, like the video, come back for more by clicking on the bell to get notified anytime I post a video, and drop your comments. I'll get to them as soon as I can. Thank you. Bye.